Hi, so I'm Raul, and this was actually day two of Stanford University's Virtual Reality and Healthcare Conference. It actually has a longer name. It's the Virtual Reality and Virtual Reality and Behavior Change Seminar. Or it was actually a two-day medical conference where doctors of different disciplines and researchers came together to talk about their research using virtual reality. So these researchers came from all over the world. I guess they were saying like people who attended came from about 22 different countries. So not everyone is using virtual reality in their clinic, but so say like doctors who are interested in the advancements of virtual reality and using virtual reality in their clinics, they came to find out more, like how to use it. Some of the interesting things that happened today is actually we had a couple talks. Let me try to get some of the names here. Some were really fascinating, like, and actually what we're seeing is that some of the research is kind of overlapping, or at least some of the like some doctors are finding pieces in their work that fit along with other researchers' work, that you can kind of put all these puzzle pieces together to try to make patient care even better, and actually could help us understand even the nature of pain, the nature of consciousness, many things along that line where you can reduce pain with just using virtual reality. In the case of today, actually, there's a lot of patients who were burn victims. So we talked to a lot of doctors who specialize in burn victims. So whether they were burned, in the United States, or soldiers who were burned during the detonation of IEDs or improvised bombs in Afghanistan and Iraq. So virtual reality was used, and actually playing a game in VR dramatically decreased the sensation of pain in these patients, and actually a very high percentage of patients noticed a decrease and almost complete elimination of pain. So with some research was done where they mix virtual reality and drugs, but either way, with or without, there was a decrease in pain, because basically it's a distraction from the pain. And so in these really severe pain cases, we're still surprisingly able to see a decrease. And this is something that's really unique to virtual reality. Another thing would be research from, I want to try to get their names. So, Jacob Ballon and Kate Hardy. They did a presentation about virtual reality and psychosis. It was a really fascinating talk, because their research is showing, saying that, to put simply, like, so if you're hearing voices, so these patients are hearing voices, and they're saying negative things, right, to the patient. The patient goes to get help. We have all these different types of therapies that have been used in the past, but now, since we have virtual reality, what these doctors have done is actually they've made the patient create an avatar for the voice, what they think the voice would look like, and then guiding the patient through. The patient can create a dialogue and a relationship with the voices in their head. So this is something really interesting, because then what the doctor could do is, there's two things. So the patient can actually become empowered to get some sense of control over the voice, and the doctor could actually help kind of guide the patient along. And this is the other thing too. It's like the stuff that I'm mentioning, and again, the research also is showing, is that you really do need the assistance of a professional with these types of cases. So yeah, the doctor then can facilitate the recovery of the patient, or at least having them become more in control of their psychosis. The other thing is that children, they perceive virtual reality differently as opposed to how adults see it. So I'm not a child anymore, and none of us in the room were children, but according to the brain research, we're assuming that children in virtual reality, they're still seeing the experience that adults would see, but it seems as though that it might be even more real for them. So then that kind of got us in this kind of conversation about the ethics of it, or if we have to explain or kind of debrief the child if they are used, or if they are exposed to virtual reality in a medical setting for whatever reason. And the other idea was isolation. So with regards to chronic pain, or even say like children who need heart transplants, or for instance chronic pain, or any situation, or say cancers, other situations where the child might have to spend more time, or this is also even an adult, where they have to spend less time in the community and more time, say, like at hospitals. Then the thing that's happening is that the social isolation that they're feeling can ultimately increase their pain. So using virtual reality and going back to the idea of avatars, and maybe even creating more social programs where people in these situations can connect with other people in similar situations around the world, that can decrease the feeling of isolation. So if they can see that people around the world, or at least around the country, or at least people who speak their same languages, are in the same situation, then they can build a community. So that would be another aspect where virtual reality can be useful. I want to see if there's anything else that I'd like to share. That was the main thing, like social apps, children's brains perceiving virtual reality different than adults. Oh, the other thing is that using virtual reality for as a distraction therapy, say like children who were burned victims, and then in the hospital they have to, basically the nurses have to clean their wounds. That's very painful. So virtual reality distraction therapy is very effective at basically having the children feel a large decrease in pain. But the other thing to that was that children getting this type of virtual reality distraction therapy actually healed faster. So there's more research needs to be done as on those mechanisms. But I think also too, basically, if the child is distracted and less stressed from feeling and perceiving pain, because a lot of times the anxiety is so overwhelming because the child is anxious. They're going to feel pain when nurses are removing the dressing and cleaning off a lot of the dead skin. So just the anxiety of knowing that that's going to happen and knowing it's going to be painful, that automatically will increase the perception of pain. So that's another thing I wanted to kind of share, where it's like, I'm sure that if you're decreasing that anxiety, then the child can feel, or the child's body can devote more energy and effort to recovery, as opposed to having these times where it's focusing on being anxious, or being in fight or flight, or being stressed out. So that will actually decrease the healing ability, so temporarily. So I think that's one of the reasons why that works. All right, well, thank you for watching. This was day 2 for Stanford's Virtual Reality and Behavioral Change Conference. Thanks for watching.